friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Welcome back to Louisiana Living. We are Physical Therapy and Balance Centers. I'm Angela Yarborough and this is Dr. Jerry Yarborough. On past segments, we've talked about the different systems that help you maintain your balance. And today we're going to be talking about the vestibular system. Hit it.
All right, thank you. Yes, so if you remember from previous discussions, to maintain our balance, our body utilizes multiple systems. For sighted people, we use our vision a whole lot. And then our musculoskeletal system with our strength of our muscles and the flexibility of our muscles and our joints. And then, of course, we use the somatosensory system and the vestibular system. Like Angela said, today we're going to focus on the vestibular system. As you can see here, the vestibular system is made up of a couple of organs and 3 different canals. And what the vestibular system does is it'll tell your brain whether you're looking right, left, up, down, whether you're sitting up or laying down. Now, it is very important that the system works accurately because it very intricately controls the movement of your eyes and your neck muscles and the signals going to your brain. So now the causes of vestibular impairments can be many things, from neurological conditions like having a stroke, multiple sclerosis, Parkinson's disease, a cerebellar dysfunction, inner ear infection, even dehydration, medication, and age all can affect our vestibular system. Now, when we're talking just about balance, most physical therapists can assist you in improving your balance. But when we're talking about the vestibular system, in order to help you the best, you need to ask for a therapist that specializes in treating vestibular impairments and provides vestibular rehabilitation. Here at Fyzical, Ruston, Jonesboro, and Dorado, Arkansas, we do specialize in vestibular rehabilitation. We have spent lots of time and money investing in innovative equipment, training, and testing to help be able to improve people's vestibular function. One of our systems that we utilize here at Fyzical is the Virtualis system. We do offer this at all 3 locations. We are the only clinics in the region to offer this specialized system to help with vestibular rehabilitation. And our Ruston location is actually the first in the entire country to have the motion VR system. So what virtual reality does is in essence, once you put on the goggles, it will like teleport you to a new environment. You're no longer standing in the clinic, you're in a home, you're in the grocery store, you're on the ski slopes, or even driving. And we use these programs and special testing to not only help diagnose exactly what your problem is, but we can also use these programs to provide quality treatment. So again, whenever you have vestibular issues, you need to seek out a therapist that specializes in vestibular rehab. And yes, in Louisiana and Arkansas, you have direct access, which means you don't have to have a referral. So just pick up your phone, make an appointment, and call for that therapist. Welcome back to Therapy Thursdays. I'm Dr. Jerry Yarborough, physical therapist. And today what we're talking about is vestibular impairments. If you remember the previous discussion, the vestibular system is in our inner ear, and it tells our brain whether we're looking right, left, up, down, sitting up, or laying down. It very intricately coordinates the movements of your eyes and your neck muscles to the signals that it's giving your brain to know what to do. Okay, so what we're doing in this segment is teaching you some things that you can do today at home to start working on improving your vestibular system, okay? And we have joining us today my son, actually, Nicholas Yarborough. He is one of our techs here. And so he's going to demonstrate some of the vestibular exercises that you can start doing today at home to help improve your vestibular system. First, you're going to focus, Nick's going to focus on you. And you're going to keep your eyes focused on an object, and you're going to move your head right to left, starting off slowly. And you're going to start doing these seated, okay? Nick's going to keep moving his head nice and slow. As he gets better and better, he's going to be able to move his head faster and faster while maintaining focus on the object in front of him. Show him how fast you can move your head, and there you go, good. All right, so you're going to go side to side, and then you're going to go up and down, same thing, stay focused. All right, do that about 10 times, and gradually increase your speed with that too. And then we're going to do diagonals, up to the right, down to the left, staying focused, and then up to the left, down to the right, okay? So those are the 4 planes of movement that we operate in, so you want to do those. The next advanced exercise from here is going to be doing these head movements, but with your eyes closed. Again, I want you to start doing it seated, and then you'll progress to a standing position, always being near something stable just in case, because we don't want you to lose your balance and have a fall. So you're going to do it with your eyes closed, move your head right to left, right to left. You'll start off slow and then faster, and then up and down, then up to the right, down to the left, and then up to the left, down to the right. Once you've got these mastered, then again, you're going to do them standing near a stable surface. The third exercise that you can do at home is working on single leg stance. So you're going to stand on one leg, all right? Once you can do that for at least 10 seconds safely, remember to always be near something stable, then I want you to start with those head movements, okay? Move your head up and down, side to side, up to the right, down to the left, and up to the left, down to the right. Once you've got that mastered, you're going to do it with your eyes closed. and this is very challenging to begin with. So again, make sure you're near something very stable or you have someone next to you to make sure you don't fall. All right, thank you, Nicholas. And thank you for joining us today. Those are things that you can start doing immediately to help improve your vestibular system. As always, we here at Fyzical are here to help you love your life and improve your quality of life. So come back next week as we talk about another impairment that affects you or could affect you or someone you love. Thank you, and we'll see you then.